Welcome to the RX Physiotherapy Podcast, your go-to destination for all things physio, rehab, health and wellness. I'm April Patterson.
And Trent.
And each week, we will dive deep into fascinating topics within the health world, from physiotherapy to nutrition and beyond. We cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness. Let's get started.
For decades, we were taught one simple rule. If the ACL is torn, it can't work. That belief shaped an entire generation of treatment decisions, but modern evidence has forced us to soften that stance. Not all ACL-deficient knees behave the same, and function is not dictated by anatomy alone. G'day, Trent Cooksley here from RX Physiotherapy, and this episode isn't about avoiding surgery. It's about understanding when non-surgical rehab is not only reasonable, but optimal. Now, the shift towards rehab-first ACL care didn't come from theory, it came from outcomes. The pivotal moment was the Froebel et al. Study published in the New England Journal of Medicine. I mentioned this paper and study, I believe, in the second podcast of this little series, and highly recommend giving it a little look as well. So patients who began structured rehabilitation and delayed surgical decision making had identical outcomes at both 2 and 5 years compared to early reconstructions. And half of this group actually never needed surgery at all, which forced clinicians to ask, if some knees function well without an ACL, what actually is happening? Now, early work by Fitzgerald and Cinder Mackler introduced the idea of copers, those who function without instability, and non-copers, those who don't. But later research showed that these particular labels are fluid and not fixed. Studies by Etzen and Grendon demonstrate that many non-copers early after surgery become functional after targeted rehab. So the question isn't, is this person a coper? It's more leaning down, has the knee been trained yet? So non-ACL rehab is it's not minimal. It demands heavy quadriceps loading, posterior chain development, deceleration and braking capacity. I'd also chuck in a bit of acceleration capacity in there too, along with progressive running and change of direction drills as well. Work by Grendon et al. Repeatedly show that quadriceps strength is one of the strongest predictors of function, regardless of surgical status. So we can kind of assume if strength is restored, ability often follows. One of the biggest fears around non-surgical care is instability. But instability isn't always structural. Research by Kiapor and Murray highlight that neuromuscular control plays a major role in dynamic stability. A knee can feel unstable because the muscles aren't strong enough, timing is delayed, and confidence is low. Rehab allows us to separate true mechanical instability from modifiable functional deficits. A common concern is long-term damage within the knee during non-surgical ACL rehab. Now, longitudinal work by Lomander and later work by Filbay shows that osteoarthritis risk remains elevated after an ACL injury with or without surgery. Surgery doesn't protect the knee from degeneration. What seems to matter more is overall load management, strength maintenance, and ongoing physical activity. Rehab doesn't increase risk, poor preparation does. Now, this matters because some knees don't tolerate high demand sports without a reconstruction. Now, red flags for this include reoccurring giving way episodes, persistent swelling, so if the knee is just really, really angry through the entire rehab, failure to regain overall strength. So main things to look out there is that quad symmetry and quad strength symmetry. Inability to trust the knee under fatigue, in these cases, rehab hasn't failed. It's done its job by revealing the overall truth. Surgery becomes a better informed, better timed, and often more successful due to the essentially prehabilitation that has occurred over the 3 to 6 months that you will see ACL patients generally. So non-surgical ACL rehab isn't about proving toughness. It's about building a knee that can tolerate the life you want it to live. Some people need surgery, some people don't. The mistake is assuming that everybody does. And in the next episode, we're going to have a little look into return to sport testing and why passing tests doesn't always mean being safe when it comes to return to sport. Cheers for listening once again, and I'll catch you in the next one. See ya.